Orthostatic hypotension is a very common problem, especially in the aging population. It's defined as a drop in blood pressure more than 20 systolic and 10 diastolic on standing versus lying down. So how common is it? At least 20% of patients over 65 have some kind of orthostatic hypotension. Only about 2% of those people have symptoms that bother them. But this isn't the only population that gets orthostatic hypotension, but it is an age-related condition. Some of the important sequelae, the things that we need to avoid, are future cardiovascular events. There's an increased risk for any type of cardiovascular event and increased mortality. So some of the risk factors, non-specific risk factors, can include carotid stenosis, systolic hypertension, oral hypoglycemic agents. So a lot of your diabetics are going to end up with this. Antihypertensives, this has been shown in some studies, but not in others. Antidepressants, opiates, and alcohol all can cause orthostatic hypotension, and then dehydration or anything that leads to a volume loss. So how does this normally get controlled? In the normal system, you have a reflex that keeps you from having a difference in blood pressure from when you're standing from when you're laying down. So this happens in the main baroreceptors of the body, which are found in the carotid sinus and in the aortic arch. And so these baroreceptors, they sense the tension in those two arteries and send a relay message through the brainstem back down to the cardiovascular system, which both increases heart rate and clamps down on the blood vessels. So this is how generally when you stand up, your blood pressure is kept the same. So, and when it goes wrong, that's going to be due to a failure in one of those systems that we just talked about. So the autonomic system is what controls this. So either we've got a failure in autonomics, or we don't have enough volume for the autonomic system to make up for the difference when you stand up. So this is an abbreviated list of the types of autonomic failure that you can see leading to orthostatic hypotension. Multiple system atrophy, also known as Shy-Drager syndrome, is a condition that can present as Parkinson's and is also associated with orthostatic hypotension. It's lumped into the Parkinson's plus syndromes. Lewy body dementia, MS, ALS, and other demyelinating diseases like Guillain-Barré, Huntington's, Wernicke's. So you can see basically any of these that cause damage to the central nervous system or the peripheral nervous system can cause autonomic failure. Hydrocephalus tumor, again, just their problems in the central nervous system or the peripheral nervous system that cause damage. Diabetes and amyloidosis, anti-Parkinson's drugs, alcohol and toxin-related neuropathy, trauma, and just any nerve disease can cause this autonomic failure. Hypovolemia. So the common causes are diuretics, hyperglycemia, hemorrhage, vomiting, dehydration. And so both dehydration and autonomic failure are associated with age. So it's one of the reasons that we see this so prevalent after the age of 65 as people have volume issues and nervous system issues, which can lead to orthostatic hypotension. So on the history and physical, you want to look for any signs of volume loss. So skin changes, any sign of dehydration, mucosal dryness. You want to look at the list of medications very carefully, because more often than not it's going to be caused by medications. In your medical history, you want to make sure we screen for heart failure, diabetes, alcoholism, and then we also want to, on the physical exam, look for any sign of Parkinsonism, peripheral neuropathy, dysautonomia, check the blood pressure. Labs, you want to get a CBC, blood sugar, and check for syphilis. All these can be associated with it. So how do we treat it? Non-pharmacologic treatment includes removing the offending medication if that's the problem. Just controlling the problem by not standing up so fast is one thing to do, at least while you're trying to figure out what the underlying problem is. You want to avoid spending a lot of time in the sun, make sure you're drinking, wear compression stockings to help get the blood back up into the heart, and exercise is good at moving the blood as well as keeping muscle tone that can help move the blood up. There's a maneuver called the standing leg cross, where you cross your legs and kind of squat down, and that will help you to move the blood up. And then just eating smaller meals. This is more associated with the postprandial hypertension. Postprandial orthostatic hypotension, and this is a pretty related condition, but they go hand in hand. So if we're going to treat this with medications, we can use fludrocortisone, which of course is a mineralocorticoid analog, which will help you to avoid fluid loss. Sympathomimetics like ephedrine, phenylephrine, and midridine help raise blood pressure. NSAIDs, caffeine, and pyridostigmine are also used.